What's the most complicated case you've had?
Patient aggressive and poor compliance. Patient refused to seek doctors.
Right. Was it because they didn't want to come here?
There is a
They were
forced them
forced
to come,
here.
is it?
Yeah.
stigma. Some they are forced by family member to come here, but during interview by doctor here, suddenly they run away. We need all the paramedics here to help patients. We try to calm the patient down and then slowly talk to patients. At last, patient can follow us and follow the doctors.
But nothing's ever, like, no one's ever harmed you, you've never gotten injured or anything before?
Some verbally abusive, argumentative regarding the medications.
I mean, you've obviously seen a lot of cases here.
Yeah.
Was there one case or a few cases that you just went, we could have done better, we could have treated that patient better? Was there ever one?
Patient once come in here, patient are totally aggressive and refuse to take medication. After we persuade her or persuade him and consult by doctors, psychoeducation given, and so far patient is okay.
Yeah.
But have you ever had like, I don't know, maybe a suicide case?
Yeah. There are a few cases here who are having severe depressions. We advise, the doctor advised to go to the admitted, but family refuses. So we cannot do anything because we just only consult and persuading them what is the main cause we asking for admitted. But when family refuses, then after 2 days in that week, patient commits suicide. That's very sad to hear that. And because what we do the best for them.
Have you ever treated a patient who came in really worse for wear and rehabilitated and now is doing well in society?
Yeah. Patient come in to see our walk-in doctor. Patient refuse to come in, and we need to call patient in with our doctors and our nurses to call up patient to come in. We try to invite patient in with the family members. Yet patient don't want to come in, and our doctor go to see patient out here, and then at last, slowly patient will, doctor will slow talk with patient, and patient will receive doctor's advice, seek doctor on treatment, and yet patient get well, come here happily and can say hi, hello.
But is the patient reintegrated into society? Does he have? Does he or she have a job?
He can do totally well.
Okay.
Can you share with us a story of maybe one of your most complicated case so far?
I had a college student who came here, and then he's doing a foundation. So diagnosed recently here. There was a case, say sometimes we do get a patient with dementia. That means older patient.
Yeah.
So here there was a very elderly person with his wife who was unwell for some time. So he was able to tolerate the behavior. Actually only both of them staying in the house. And then this lady went to a level where she was like playing with a fire, playing with a knife, because she's like demented and she had some other psychological symptoms along with the dementia.
Right.
So that means the husband came to me, and then we diagnosed her, gave some treatment, somehow able to manage. So he was very happy. But after some time the patient passed away because already 90 years. So some cases are very successful, so we are very happy with the outcome. But certain cases, like I say, difficult cases, it's a little bit challenging for us. So we do our best.
Is there one in particular where that stands out for you and go, like you're very proud of how that patient did, coming in maybe in pretty bad state, but then recovered really well, reintegrated into society really well?
Yeah, I had again this college student, very brilliant college student. I think she's JPA scholar, and then somehow she had this illness, and then she came to us for treatment.
The thing just manifested out of the blue.
Yeah, started by the time when she wanted to join the college after STPA.
Right.
So there were some issues, and then with treatment she managed to the first course she was offered is a little bit difficult for her. So with our help, she managed to change to another course. So which she find the second one is she's doing very well, and she did go for attachment overseas, and she just came back recently. So
And she came to say hi to you?
yeah.
Oh,
Yeah.
that's nice.
How's she doing
Because
now?
we arranged the medication for her to carry to the other country for 4 months supply. Normally we don't do that, so I have to pass the custom, and then
Right.
I have to write a special letter and everything. So she managed to come back, and then now she's still again back to the college and continuing her studies.
Right. Do they relapse though?
Yeah, there is something called express emotion. That means it comes from the family members' attitude towards patient. So if there's something called very high EE, that means emotional expression towards the patient, is constantly criticizing the patient, and then so it actually causes, it's one of the reasons patient have a early relapse, and then they have this illness again.
Yeah. What's your advice to family and friends out there who think that maybe one of their family members or one of their friends might need some mental health help?
My advice is early find a professional, get a professional help if they notice something is not normal. Not until the stage where a patient is having a full-blown relapse and then carrying a knife and running around. So sometimes it can be too late.